The Trump administration announced Tuesday that states will no longer be able to use federal Medicaid funding for gender-affirming surgeries and hormone treatments for transgender minors. The Children's Health Insurance Program, known as CHIP, will also stop paying for those treatments for people under age 19. The new policy, which is scheduled to take effect October 13th, is part of a series of Trump administration actions restricting transgender-related health care and other policies since he returned to office last year. Under the administration's policy, Medicaid and CHIP would continue covering mental health services for transgender minors. Those already receiving covered hormone treatments will have a transition period before federal funding is phased out in April of 2027. It remains unclear how much taxpayer funding is going to cover gender-affirming treatments for transgender youth now. The Centers for Medicare and Medicaid Services did not respond Tuesday to questions by the Associated Press seeking additional information about the policy. Trump said in a social media post Tuesday that he directed Dr. Mehmet Oz, administrator of the Centers of Medicare and Medicaid Services, to carry out the change. Trump said on Truth Social, "We are not going to pay for our innocent children to undergo these barbaric surgeries and practices which result in unthinkable and irreversible harm to their young bodies." LGBTQ plus advocacy groups have strongly opposed the administration's approach, arguing that the new restriction interfere with a family's ability to make healthcare decisions with medical professions. Josh Rovinger, legal director of LGBTQ Legal Advocates and Defenders, said the policy is putting up barriers between parents and their ability to make the best medical decisions for their children and will face a legal challenge. Human Rights Campaign President Kelly Robinson also criticized the administration's actions, saying they have created fear and uncertainty for transgender young people and their families. HRC is already involved in a lawsuit challenging administration efforts to prevent federal employee health benefit plans from covering gender-affirming care. Robinson said in a statement, the Trump administration is terrorizing trans youth and their families with these kinds of actions, and it has to stop. Access to gender-affirming care for minors has already been restricted across much of the country. At least 27 states have banned such care for people under 18. In states without bans, some major hospitals have also stopped offering certain treatments. Gender-affirming surgeries among minors are uncommon, while treatments such as puberty blockers and hormones are more frequently used. The administration has previously proposed to bar hospitals from Medicare and Medicaid participation if they provide certain gender-affirming procedures to minors. It has also moved to restrict transgender athletes from competing in girls' and women's